start the program. Thank you all for being here. It's great to see such a big crowd. Thank you for coming in December, the busiest month for so many folks. So my name is Danielle Nierenberg. I am president and co-founder of Food Tank. For those of you who don't know, Food Tank is a research and advocacy organization really devoted to highlighting stories of hope and success in our food and agriculture systems. I'm so excited to welcome all of you who are here in person as well as watching online. Thank you so much for taking the time to be here. Today's event is going to focus on ultra-processed foods, foods that are under growing scrutiny for the links that exist between these products and negative health outcomes. And I just want to share some facts with you to sort of give some context. An estimated 70% of the US food supply is ultra-processed. These foods are engineered in a way to be hyper-palatable and appealing using combinations of fat, sodium, and additives to become extremely craveable. And a landmark review just published in The Lancet says that the rise in consumption of ultra-processed foods increases the risk of multiple diet-related chronic diseases, including obesity, type 2 diabetes, high blood pressure, cardiovascular disease, chronic kidney disease, depression, and other health problems. One of the authors of the Lancet study writes that the evidence is now strong enough to justify a global public health response. So today we're going to talk about what ultra-processed foods are, the science behind them, and we'll discuss the programs and policies that can help eaters overcome the barriers to access healthy, nutritious, and delicious food. Before we start, I'm delighted and excited to thank our partners at the Food is Medicine Institute at Tufts University, especially Dariush Mozaffarian and Emily Callahan. Can you give them a round of applause, please? I also want to give a huge thanks to the Hill staff, especially the catering and production teams. Give them a round of applause, please. It is now my honor to welcome U.S. Member of Congress, Shri Thanadar, who represents Michigan's 13th District, to give some opening remarks. Please give him a round of applause.
Good afternoon. How is everybody? Good? Good to see you all. Good to see you all eating very, very healthy food. Did you like the lunch? I had nothing to do with it, but thank you all. Thank you for Tufts University and organizing this event, bringing the awareness of the need for healthy food in America. We have essentially a crisis all across America in terms of access to good, healthy food. And I'm an immigrant, just to tell you a little bit about. I was 24 years old, living in poverty in India. And I got admission into a PhD program at University of Akron, started getting PhD in chemistry. And I came here at the age of 24 with $20 in my pocket to America. And I'm just so glad I have the honor and fortune to be able to represent Detroit in the United States Congress. Now, Detroit, as you may know, one of the major cities, but our city is nearly 26% of my city lives at or below poverty. Access to good, nutritious food is always an issue. Many people lack transportation. And people that I've met, I've seen their only access to groceries, food, is a nearby gas station that they can walk to. And that's how difficult it is to be able to get good food, good nutritious food in impoverished areas, in urban areas, all across America. This is not unique to Detroit. It is a story of many urban cities. And to counter that, now in Detroit, we have several community gardens. gardens where good, healthy, nutritious food is cultivated, and we have about 22,000 community gardens, and we're starting to encourage more and more of gardening in the communities to access vegetables and fruits and good, nutritious food. But this fight is far from over, and I am thankful to all of you for being here, thankful to bring Congress's attention, not only for making awareness, education, as well as regulations. You know, the amount of sugars that you find in drinks at fast food restaurants, the type of, the quality of food that is accessible through fast food is questionable. And in some 35 years ago, I was diagnosed with type 2 diabetes. And that was an eye-opener. It was almost a blessing in disguise, an eye-opener that made me aware and take a look at my health. And a big part of health, as you all know, is what we eat. And it really forced me to look at that. And it turned out to be a blessing in disguise. I was able to focus on my food, but many people don't have that luxury. So to make this aware, Congress needs to act. Congress needs to act on the drinks, the sugary drinks. Congress needs to act on the ultra processed foods. There ought to be and need to work on a bipartisan way to provide a regulatory framework to make America healthy. So thank you all for being here. Thank you for your concern, and thank you for the invitation to be here. I appreciate it.
All right. So thank you so much for being here, Congressmember. We're now going to turn to our first panel to talk about the science of ultra-processed foods and how communities are helping eaters access healthy alternatives. So I'd like my panel to come up, and I'll just introduce them. Joining me, we have Dariush Mozaffarian, the director of the Food as Medicine Institute at Tufts University. Round of applause. Dariush's a legend. We have Radha Muthiah, who is the president and CEO of Capital Area Food Tank. She's a legend too. Thank you for being here. And we have Anurag Chigru, I'm going to mess up your name, Chigurupati. You want to say it?
Chigurupati.
Chigurupati, thank you. I had it all practiced out too, so give him a round of applause. So, Dari, I'm hoping I can start with you. You know, in my opening remarks, I talked a little bit about sort of the impact of ultra-processed foods, UPFs. I'm wondering if you can sort of share the science behind these foods and why they're so, harmful to all of us.
Yeah, so thank you. So happy to be here with everyone and to co-host this with Danny and Food Tank. Ultra-processed foods are really a crisis in our country and around the world. The main insight around ultra-processing really came from a scientist in Brazil named Carlos Monteiro, who I've worked with quite a bit, about 15 years ago. And he thought, there's something going on with our food beyond the traditional nutrients. Yes, we need to focus on salt, we need to focus on sugar and some other nutrients, but there's something about the processing itself. And so he wrote a paper in Portuguese, being from Brazil. He said, I'm going to propose a new classification framework, which is based on the processing. The word for new in Portuguese, anyone know the word for new? Nova. So the Nova classification system, which you may have heard of, is it means new in Portuguese. And he said there's something about processing itself, not the nutrients, that's important. And so because of that, he started doing studies, and now there have been over 100 studies around the world, observational studies, but also 3 randomized trials in Japan, in the United States, the United Kingdom, all showing that even if you account for the nutrients that we all think about that we should or shouldn't eat, fiber, protein, carbs, fat, et cetera, processing itself has significant harms. And the mechanisms are likely multifactorial, but all of these mechanisms have been shown to be important in humans. And so one, of course, is there are some nutrients that are worse, salt in particular, sugar in beverages in particular, starch is in particular, not fat, but starch is a problem. But there's also other challenges. I think the biggest one is probably the acellular nature of ultra-processed foods. They have been molecularly disassembled and reassembled, losing their natural intact structure, which changes how they're digested by the body into the microbiome. Third, there's the actual additives. Many, many additives have direct harms. They can be carcinogenic, they can be endocrine disruptors, they can be obesogens, they can have many significant harms. Then there's contaminants from the fields, pesticides, contaminants from the packaging, microplastics and the processing. And then finally, there's the way they're marketed and packaged and the portion sizes and the way they're sort of made. I shouldn't say finally. And then finally, the hyperpalatability. They're also engineered to be hyperpalatable. It's not any one of those things that's important. You can't just say it's hyperpalatability or it's just sugar or it's just salt, or it's all of those things put together. And so this is the kind of biggest, I think, challenge in the U.S. food supply is how do we start to reduce exposure and consumption of ultra-processed foods, and how do we have the food industry start to reformulate and create foods that are actually still convenient, tasty, but not ultra-processed?
Thanks, Dari. You mentioned NOVA, but I am sort of puzzled why there is not an agreed upon definition of UPFs in the United States. Can you talk a little bit about that?
Yeah, so I'm excited that the federal government, this administration, has announced plans to create a federal definition for ultra-processed foods. I think that will be very, very important. In my own conversations with states, with many of my own peers, I'm a little concerned, actually, that some people are using this attention on ultra-processed foods as kind of a backdoor to go after saturated fat or sugar and salt. I just explained to you that it's not the nutrients that are the major issue. It's all these other things. And so the main thing I'm concerned about, Danny, is that some of my peers or people who mean well are going to get really excited that, like, this means we can go after sugar-sweetened beverages as the main issue, finally, or we can go after X or Y or Z, or high-fat foods, in quotes. I'll put that in quotes. And I think that that's a big problem. And so the states have been innovating, but I think with mixed success. California has passed a law which has some really good aspects to it. They define the artificial additives and ingredients and processing methods really, really well, actually. But then they add additionally criteria around saturated fat, sugar, and salt, which I think was a huge mistake. And it's actually a loophole for industry to drive through, just like they do for school meals, and make ultra-processed school food that meets nutrient criteria but is still ultra-processed. So I think California started to get it right, and unfortunately, I think I pulled back. Pennsylvania and Massachusetts have proposed bills which are actually excellent. In Massachusetts, which is probably the best overall definition, they have all the additives defined by FDA technical criteria that should meet ultra-processing, and they add nitrites for processed meats, which isn't part of the traditional definition. I think that's an excellent definition. And then lastly, Pennsylvania, in addition to doing that, has an exemption. They say, look, not ultra-processed foods are the same. And so if an ultra-processed foods meets the definition of FDA healthy, which is actually a very good definition, it could be exempted. So I think this is the movement, and I hope that the federal government will really focus on the processing, not the nutrients, and follow the examples of Massachusetts and Pennsylvania.
Thank you, Dari. Thank you for setting the stage for this. Anurag, I wonder, as the Chief Operating Officer at Devoted Health, I'm wondering if you can talk about the portion of medical costs that come from, that are tied to diet-related diseases. What are the numbers we're looking at?
I'm happy to speak to it. It's Devoted Health. We're a health insurer and a medical group that's focused heavily on prevention with the mission of improving health and life for seniors by caring for them like they're literally family. And so we focus really heavily on prevention, and it turns out about 73% of total healthcare costs for seniors are tied to preventable chronic conditions that are highly related to nutrition. So diabetes, heart failure, a number of others. And we found in our own data, part of what we've done over the past few years is to offer a grocery card of a couple $100 a month for about half of our members as a benefit. As we looked at the data on how grocery card utilization tied to healthcare costs, it turns out that of people who have high soda purchase rates and on our grocery card, we found a 14% higher rate of obesity, 16% higher just total medical expense across the board, hospitalization, specialist utilization, all of that. And maybe most shockingly, 31% higher rate of depression. So these probably won't surprise people in the public health world, but it just became very clear to us that addressing nutrition was really important to controlling chronic costs.
And so what did you cut the opportunity for people to buy soda or candy out of those grocery cards, right?
Yeah, that's right. So a couple of years ago, we started to look at this data, and it was clear we had to do something. we realized we needed help, though. It's tough for any one organization to be the only plan out there in the market that restricts use of cards. And so we started advocating and working with CMS for clarification of the guidance that would come out. And so this year, there's been new guidance issued that's clarified that Medicare Advantage plans should not offer non-healthy food as part of the benefits. And so we were able to use that to restrict usage. And so starting in 2026, we're not going to have soda or candy purchases with the grocery card, which we think will help to really shift towards healthier purchasing behaviors and shift the nutrition and help us with our kind of mission of prevention.
Sure, and I know you've already thought about this, but do you anticipate a lot of pushback on that?
We were worried about it. We honestly were worried because I think often people don't like just constraints. But as we started to roll this out and announce it, we've just come to the end of the open enrollment period. As we started to share it, we found that brokers were applauding it. We haven't gotten the pushback we were worried about. I think people understand that nutrition's linked to their health, and so they're not maybe surprised to see a prevention-oriented healthcare company.
Yeah, it's kind of surprising, but it's good to see for sure.
And Danny, if I could just quickly add, all Medicare Advantage plans can do this. CMS has specifically said that non-healthy foods shouldn't be served anymore, but Devoted Health is actually one of the only ones that's following the rule. So most plans are not changing their offerings at all, and they're sort of daring CMS to do something about it. So I think Congress and CMS should both act to enforce the rule.
Thanks, Dari. Thanks. Radha, the Capital Area Food Bank has policies in place to make sure that you can offer neighbors healthy, nutritious food. And I'm wondering if you can talk about, how you developed those policies and if you've had pushback.
Sure. The Capital Area Food Bank covers the greater Washington area, and we provide food to about 1.5 million people who needed a little extra assistance putting food on their tables. It has always been clear to us that addressing hunger alone is not really the core of our mission. The core of our mission extends to addressing hunger and improving health outcomes. And so having that be a part of the mission has really clarified the kind of food we accept, the kind of food that we distribute. So about 10 or 15 years ago, we made the move as the first food bank in the country to say we will not accept certain types of foods that are high in sugar, high in salt, low in fiber, et cetera. And there was a lot of pushback at that time because it was a very controversial decision with a lot of people on both sides. Some people saying food is food. People are hungry. You should accept that. And we said as long as we can provide enough food to those who need it, we would prefer to provide nutritious food. And so we took a stand on that. And gradually, over time, that has become more acceptable, and food banks across the country are doing that. In our case, we're very focused, to Dari's point earlier, on fresh produce and protein. So 40% of everything we distribute, and we track it daily, has to be fruits and vegetables. Another 10% at least is protein. Could be vegetable-based, it could be meat-based. So that is important. And we have seen through some of our other programming and our partnerships with hospitals how important that is and how you can really move the dial on health outcomes, especially with diabetes, hypertension, cardiovascular disease, high-risk pregnancies. We've seen incredible outcomes there as well. So we know the impact. And to what the congressman said earlier, our population is those who understand and know the choices that they should make. It's just they don't have the ability financially to make those choices. And so we try and facilitate that so that they can make the choices that they desire to make and to take care of themselves and their families.
Yeah, thank you. You're also doing something that other food banks aren't doing. You're tracking the nutrient content of these foods. And I'm wondering, is this a model that you anticipate other food banks will follow?
Yes, it's, as I mentioned, for us, it's we don't get as much food donated that fits into the categories that I just spoke to, right? We don't have enough fresh produce that's donated to us or protein. And so we use our philanthropic dollars to purchase all of those items. And increasingly, as more and more food banks are doing the same, there is a greater understanding of the importance of that and the fact that you can really address multiple outcomes. So we see increasingly foundations and others who traditionally may not have been focused on food security, but are focused on healthy lives and healthy people and community health, increasingly being engaged as well. I think the other thing that's important to mention is how we really work with hospital systems, with federally qualified health centers, with community care clinics to track the health outcomes and to track the cost. Because ultimately it becomes very important to show that nutrition is a cost-effective intervention so that more plans can really take that on. So we're not just tracking what those health outcomes are, but we're actually measuring how expensive it is. And in this case, not so expensive, to be able to offer nutrition as an intervention to improve health outcomes.
Thank you. Anurag, if I can turn back to you. You described the work that Devoted Health has been doing on the role that food plays in healthcare as a journey. And I'm wondering if you can sort of describe that journey and how you came to be where you are now.
Yeah, for us, I think it started in 2020 at the start of the pandemic, as we as people locked down. We wanted to make sure we were that many of the seniors in our plans had all of their medications and medical equipment and other things kind of taken care of in that moment. So we started a massive campaign to just place phone calls to all of them. And as we called, the thing that actually came up more often than anything else was food, understandably. And so that was the beginning for us of the journey towards understanding more deeply the role that food played in the overall health picture for the population we serve. Over time, that led us to prioritize kind of access to nutritious food as a benefit, which is what led us to want to offer the grocery card as part of our health insurance benefit offering. And then, as I mentioned, as we started to see how people were using that, and then see the association between the particular types of foods that they were purchasing and health outcomes, that's led us now onto this journey of trying to nudge and incentivize people towards kind of food purchases and food consumption that does more to promote their health. And we're also working on sort of counseling and other coaching, particularly for some of our programs focused on diabetes or hypertension.
Sure. What does that counseling and nutrition education look like?
Comes in a few different forms. So there's a Medicare covered benefit for medical nutrition therapy, and we offer that very, very broadly. And I think up to 3 visits a year are covered with a registered dietitian through that program. And so we've partnered with some organizations that provide virtual counseling to do that. We also I lead operations for our medical group. We have particular programs focused on patients with diabetes or hypertension, and that looks like working really intensively with them over the course of a couple of months, meeting with them every week, talking through food choices, adjusting food choices, and then seeing how that shows up in their blood pressure or in their blood sugar for diabetics, and then sort of over time that we found that leads them to the quick feedback loops combined with what they're changing on nutrition have really make a difference.
That's incredible. And those registered dietitians, for all of those RDs in the room, shout out, because you have such a critical role in all of this. Give yourselves a round of applause, dietitians. Dari, Anurag was talking about how COVID opened so many people's eyes to the connection between food and health. But when we're talking about UPFs, ultra-processed foods, they tend to be less expensive than, healthy, nutritious foods. And, especially right now, a lot of eaters are struggling to put food on tables. How do we balance the affordability of these foods with, the health outcomes that they're creating?
Yeah, it's an excellent question. Ultra-processed foods are overconsumed by all strata of society, but particularly, Americans who struggle based on geography, income, education, nutrition literacy, disability, other issues to eat a healthy diet. For me, I think the most important thing is to use the investments we're already making, to use those investments, to shift those investments towards healthier food, and that then leads to kind of a wonderful virtuous cycle all the way down the supply chain, including to American farmers, to help support American farmers. And so just looking at my amazing panelists here, the Medicare Advantage plans, it's hard to get a single number because they're all different plans, but my estimate is about $10 to $15 billion a year are being spent right now on these grocery cards. That's not small change, right? And these grocery cards mostly are just buying junk food and whatever happens to be advertised. And so I think shifting that $10 or $15 billion to healthier foods will drive market responses and supply and other things. Similarly, food banks, if people have this sort of view of food banks from 30 years ago that it was all like, processed foods and junk food, go visit the capital area food bank. It's not your, grandmother's food bank anymore. The food banks have been a leader in thinking about turning to not just food security, but nutrition security. And so all of those dollars going through. And as I think we'll hear about on the later panels, we have SNAP, $100 billion. And then we have all of healthcare. Healthcare is $5 trillion. We spend about $1 trillion on groceries in the US, and we spend $5 trillion on healthcare. What if we took $100 billion of that $5 trillion we spend on healthcare, just $100 billion to address the top cause of poor health, which is poor nutrition? That's 10% more dollars for their entire grocery spend that we could spend on healthy food. So, and especially targeted that to low-income Americans, struggling Americans. So to me, like as a physician, I'm a cardiologist, the healthcare system is important, but we are spending a lot of money and have the worst health outcomes of all high-income countries in the world. Let's shift all these investments towards healthier food for everybody, for all Americans, but particularly for lower-income Americans.
Absolutely. So we have about a minute and a half left. I would like for each of you to take about 30 seconds. We're in a room where so many important decisions are made. To take 30 seconds to give a call to action to policymakers about what they should do on the issue of ultra-processed foods.
We'd love to keep working with CMS and others on just really focusing on prevention of chronic disease as a priority and helping steer towards incentive structures and regulations that encourage the healthcare system to move in that direction.
Thank you.
Not too dissimilar in terms of really looking at different types of interventions like the 1115s and others that allow for Medicaid in particular to be able to reimburse for good, nutritious food.
Thank you.
Danny, you mentioned the room, and we should thank the Senate and for giving us this amazing, beautiful room, and for all the congressional staff and others who are here. Thank you for being here. So I think first and foremost, this has to be in the top, 2 or 3 priorities for Congress, period. I mean, Congress is thinking about the economy and jobs and healthcare spending and, national security and all these issues, and somehow food is missing from the conversation in many offices. This is the central issue of our time for our economy, for our health, for our future, for our kids. So number one message is just put it on your agenda and think about ways to work. I think second, this is a bipartisan issue. This is actually an area where both parties, 3 parties, if you want to count independents, everybody can get together and really work on common sense policy. And we've seen that with some bills that have been introduced by Senator Marshall and others, by Congressman McGovern and others, Senator Booker and others. There's some real bipartisan action here. So let's get those bills passed. And then I think third is to really use the investments we're already making. Again, we're already investing hundreds and hundreds of millions of dollars in diet-related disease care and for food in various ways. And so let's use those dollars. We don't have to use new dollars. Let's use those dollars to pay for healthy foods. And then specifically in ultra-processed foods, I think as we'll hear about, I think FDA has a lot of exciting things they can do from an administration perspective that doesn't need legislation. So I hope that the administration moves forward aggressively and following the science.
Fantastic. Great point to end on. Please give these panelists a round of applause. Dari, you stay where you are. So we're going to move into our next session to talk about the issue of nutrition and health from a policy perspective. So Dari, over to you.
Thank you so much. If I can have my panel please come up and join me here. Just please come up and take your seats and I'll introduce you. So we have Jennifer Pomeranz, who's a lawyer, associate professor of public health policy at NYU. Arvin Singh, who's the secretary of the Department of Health of West Virginia. Robert Paarlberg, who's a professor of public policy at the Harvard Kennedy Center and of political science at Wellesley College. And Kyle Diamantas, seated right next to me, who's leading all of the food and nutrition efforts at FDA. He's the deputy commissioner for human foods at the FDA. So this is a terrific panel to really talk about state and federal policy. What are states doing? What's the federal government doing? How are we actually trying to address this challenge of ultra-processed foods? I think there's, Oh, my mistake. So thank you for giving me that. So you guys just sit here. Oh, actually, no, we need the seat. So Senator Marshall is here, and so we'll switch to Senator Marshall and come back to the panel. Thank you. Yeah, perfect. Yeah, yeah.
I'd rather just listen.
No, you can say.
They got more important things
Yeah,
than I do to say.
Yeah.
Hey, good to see you, man. How are you? Thank you so much. Yeah.
Well, this is the fun part of live events, right? You can just switch direction. So I'm really delighted to be sitting here with Senator Roger Marshall, physician, one of the members of the DOC caucus in the Senate, really someone who's thought a lot about food and nutrition from his own experience as someone who's delivered thousands of babies in Kansas and is now first in the House and now in the Senate. We've met in the House when you were still in the House, really thinking about food and nutrition. So you've been a leading voice in the Senate, thinking about the health burdens, the economic burdens of poor nutrition, and how we really have to address this. And I think I've heard you say one of your goals is to reduce healthcare spending, and how are we going to do that if we don't address diet-related disease? And so why do you think Congress should care about nutrition and from your own perspective?
Well, Dari, great to be with you, and thanks to Tufts and Food Tank here for hosting this as well. You and I were talking about food as medicine before there was a MAHA group, that this is just part of our DNA. For me, I was delivering a baby a day, seeing 30, 40 prenatal visits a day, and I just saw my diabetic clinic grow, where I'd have to take every Monday morning and see nothing but the diabetics in my clinic. And certainly there was a nutrition component to this. The average first weight for an OB patient grew 20 or 30 pounds in my career. And with that, the C-section rate, the infection, all those types of things. So, it's the right thing to do, right? My grandma used to say, if you have your health, you have everything. And then you put on your legislator hat and you figure in a $7 trillion budget, we're spending probably close to $2 trillion on healthcare within the federal government. As a country, we're spending $5 trillion a year. And it's always interesting to me when my friends across the aisle, for whatever reason, they'll talk about the amount of money we're spending as a nation on healthcare, but our outcomes aren't as good. And they look at me like, well, it's you doctors' faults. Why can't you fix this? And one of the reasons we have such a high spend is because we're a sick nation. And it's more than obesity. I think it's the inflammatory diet that we had that leads to cancers and autoimmune diseases. And you know what? You and I knew in medical school about nutrition and health with this much, and now it's only this much. But I think we're making progress.
Yeah, I think you're absolutely right. I think physicians aren't getting the education they need, and I think that's something that's now happening. Texas, for example, passed a law that all of their medical schools have to teach nutrition. Other states are considering similar things. I also think your point about how rapidly this has happened is important. This happened in our adult lifetimes. And so for me, that's important. This isn't something that's been trickling along since the 1930s or 1940s. All of this happened, this burst of diet-related disease, around 1990. Around 1990, 35 years ago. And we can actually trace it back to the growth of commodity crops and ultra-processing. And so we can fix it. We can fix it. We can go back and see what we've done and how to fix it. And so speaking of that, among the solutions, one of them is to think about the role of FDA in regulating additives. And there's a provision called GRAS, which has turned into kind of a loophole for the food industry to put in additives to food, but call them generally regarded as safe or GRAS. And so you've just introduced, I think, an important piece of legislation, along with a couple of your colleagues, to think about how do we fix this GRAS loophole. So why do you think this legislation is important? Tell us a little bit about the legislation.
Well, I think number one is that consumers are demanding this, right? My kids are this MAHA age group, and they want to know what they're eating. So I think the first step is total transparency. And right now there's loopholes, so they don't have to list all their ingredients. So we want to know what's in our food, and then we want to see the science. And if this is science relied upon from the 1940s, do we think that there's different carcinogens? Do we know more about carcinogens today than we did in the 1940s? We did. So consumers are demanding it. Again, it's the right thing to do. and we want to up our game. And I just appreciate the food industry starting to embrace this. I see the fast food industry starting to embrace it as well. We're going in the right step, in the right direction. It'll be hard for government to get this right, though, Dari. It's going to be really hard. It's kind of Goldilocks, not too cold, not too hot. This concept of preemption. There's some really good work done in the states. And they're afraid that I'm going to undercut them, and I don't want to do that as well. So where do we establish the guardrails? And I really think that's what this next semester, I'm still kind of in my school mode, our next semester in Congress is what do those guardrails look like when it comes to grass? But certainly we know the status quo is not acceptable. And you and I have had this, where do you think we should go with it?
Well, so for people who are less familiar with this, I'm often asked, how come there's hundreds and hundreds of additives that are banned in Europe, but they're allowed in the United States? That's because the United States is a pretty unique loophole. We don't just have additives. We have a whole second category that other countries don't have called GRAS, generally regarded as safe. And so when Congress created the law many years ago, they said, okay, additives need to be reviewed, they need to be vetted, they need to be publicly sent to FDA, we need to know what's in them, we need to know the safety data. But for things that are generally regarded as safe, industry doesn't have to do that. And Congress intended this for things like ginger and turmeric and black pepper, things that were generally regarded as safe. You didn't have to go through all this rigmarole. But they didn't define what GRAS was and what additives they were. They said GRAS is anything that's not an additive. That was it. They defined it by not being an additive. So industry, of course, loves a loophole. And 99% of additives that are added into the U.S. food supply in the last 20 years have been through the GRAS pathway, not through the additives pathway. And the vast majority of those have never been sent to FDA. Food industry does their own science testing. They hire their own panels of scientists. They keep the data under lock and key. So I think your bill, which first changes the law so that those notifications have to be public, and the FDA has to receive them and publicly release them, I think is really important. I think the second thing beyond public notification is, as you said, to update the actual rules for safety. The rules are really based on decades-old science. And the two things I'd like to see Congress do is to update the rules to say anything put in our food, whether it's GRAS or additive pathway, has to be safe, not just the usual things like carcinogenesis and other things, but also for the microbiome, which the science didn't even exist when the law was passed, and also neurodevelopment in kids. Many, many additives, their pathways are through these two things: neurodevelopment, brain development, behavior, and the microbiome. So I think those would be two really important things. Yeah.
And to me, one of the big emphasis is putting the F back in FDA. And I'm excited with Dr. McCary and what he's doing, and he certainly is committed to this as well. But on the one hand, don't want senators writing these rules either. So we will need a little bit of help from the food part of FDA as well. And truly those closest to the problem understand it better than I do.
Yeah, I think, as you said, the status quo is not okay.
Right.
And these have been problems that we've known about for decades and not fixed. And I think we actually have a unique opportunity to do it. So I think that's really, really wonderful. And so we have a couple of minutes, Senator. And my last question is really about, beyond ultra-processed foods, you've thought about lots of things: soil health for our farmers, prioritizing healthier foods in SNAP, doing food as medicine, for example, through the Medically Tailored Meals Act for Medicare proper. Can you tell us more about your bigger vision of kind of other actions for Congress and how the public and other offices here can work with you?
Right. So DC so much functions in silos, and I'm fortunate to be on the Help Committee and the Finance Committee and the Ag Committee. So what is agriculture's role in all this? And trust me, my farmers want to grow healthy food. So we're trying to figure out, well, what does healthy food look like? And to me, the great opportunity is the focus on healthy soil. Healthy soil is where agriculture meets MAHA. Dari, I think that there are nutrients in soil that we can't even measure. I think there's nutrients in food that we still don't know even exist yet. But I do think that it's going to come from the soil. So by modern agriculture practices, a lot of it's regenerative precision agriculture, we can get there. We can have a more nutritious food. Quit focusing just on calories. Let's focus on the nutritious content of that food. And so it costs money to do that, to make that transition from the focus on how many bushels of corn per acre can we grow as opposed to a quality. It's going to cost money for this precision. And what I'm talking about is growing more with less water, with less fertilizers, focusing on capturing any type of fertilizer that's out of the soil, keeping it from being in the river, in the air, all those types of things. And so maybe 10% of agriculture is adopting that right now, and they're making incredible gains. But we have the other 90% to do. And one of the big secrets to me is the carbon credit industry. So a lot of the people, whether it's Microsoft, Google, they're buying these carbon credits. So a lot of the things that make the soil more healthy is also very environmentally friendly as well. So we got to be able to pay for these practices beyond what the federal government can do. So that's one example. I'm going to brag on my staff that we got whole milk across the finish line. That's one simple example, but it took us 5 years to do it. Now, you don't have to drink whole milk if you don't want to, but I think it's a very nutritious drink, and it decreases satiety, it helps you absorb fat-soluble vitamins, all those types of things about it. Certainly it's a better, healthier choice than, forgive me, a cola to drink as well. So those are some simple one-off things that we can do, but my big focus is how do we have healthy soil, which is going to lead to healthier food.
Yeah, I think I'm so thankful you brought up the farmers, right? We talked about RDNs and healthcare and the charitable food system and government, but obviously we have to also help our farmers be successful, and rural economies are struggling, and rural communities are struggling. The American farmer is among the most innovative worker we have in the American workforce. They're really trying to innovate, but they need a market. Many of my colleagues say, we just have to change what the farmers grow. The farmers grow what people buy.
Yes.
And so we have to change the market, change demand through our investments, and also help the farmers with what they want to do already, which is grow healthier food. And I like your focus on soil health, on regenerative ag. I think that's really powerful. And imagine if the U.S., instead of being the country that's exporting ultra-processed foods and illness to the rest of the world, becomes the breadbasket for regeneratively grown, healthy, nourishing food for the America and the world. This is an economic advantage for us as well. So this is really a moment when I think Congress gets this, the public gets this, industry gets this, farmers get it, healthcare gets it, and I think we need to harness all of that. And so thank you for your leadership. Thank you for being here, Doc. I really appreciate it, and I appreciate everything you're doing. Thank you.
You're welcome. Thanks for having me.
Come on back. Yeah. So we have several members of Congress who are going to drop in, and so when they come, we'll work them into the program. We had several members who wanted to come speak, which is a great sign. So we will turn now to our panel two. So if I thank you for your movement, and if anybody in the audience wants to get up and take a stretch break, that's good too. So again, I'm going to welcome Jennifer Pomeranz, Arvin Singh, Robert Paarlberg, and Kyle Diamantas for our second panel, really thinking about the federal and state actions that are going on. There's some really, really exciting work going on in the states. The states are, in 2025 alone, doing remarkable things around ultra-processed foods. And so I'm going to start with you, Arvin. As the Secretary of Health for West Virginia, what's West Virginia doing around ultra-processed foods and nutrition more broadly?
Thank you, Darian. Thank you for having me here today. So in West Virginia, we decided to act instead of just talk. And earlier this year, our Governor Morrissey, and our West Virginia legislature overwhelmingly passed at over 80% in both the House and the Senate, one of the nation's strongest and strictest food dye bans that would protect children and communities. from these unnecessary dyes. And it went beyond just petroleum-based food dyes, which are your red dye 30, red dye 40, but we also went to the preservatives, the BHAs, the BHTs, the propylparabens that serve no nutritional purpose. And we did it responsibly. We had the schools go into effect in August already of this year, so they're already complying with that ban. And we have now asked that retail across the entire state of West Virginia go into full compliance by January 1st of 2028. We felt that was responsible. It was economically correct to allow the manufacturers enough time to retool and reformulate to be able to effectively meet our legislative ask for that. In addition, SNAP. For SNAP, we submitted to the USDA, and it was approved in August of this year, that we would have a waiver that would restrict soda purchasing through the SNAP program. That way we meet the intention of SNAP, which is supplemental nutrition, not to have soda in those diets. In addition, that will go into effect January, so just a few weeks from today. And in addition, we also have our WIC program. We've been redesigning our WIC shopper's guide to be effective, to have nutritional safety in what we're giving to our women and children. So those are some of the efforts we're doing across the state of West Virginia to really protect our communities and our children.
Thank you for sharing that, Arvin. There are multiple states now taking action with at least 30 bills proposed and I think 10 passed around ultra-processed foods and at least 12 waivers around SNAP that have been approved and others pending. And so, Rob, you're a political scientist who's thought about the SNAP program for years and how to prioritize nutrition. And for example, you've written a paper about the iron triangle of resistance to improving nutrition in SNAP. Tell us about this last year. What's happening, what the history was to get us here, and what you think about the state actions.
Yes, it's been a revolutionary change in 2025 in the SNAP program. Before this year, when states asked USDA for permission to place a restriction on the sale of foods through the SNAP program, the Secretary of Agriculture always said no. Democrats, Republicans, it was always no. This year, influenced in part by the MAHA movement, we've seen a major change. 12 states, including West Virginia, petitioned for a waiver to place restrictions on ultra-processed foods, mostly soda, but also candy, and in at least one case, prepared desserts. And the Secretary of Agriculture approved all 12. So this is a big change. But I want to be careful here about some of the risks that we might encounter going forward. One is definitions. What's candy? If I'm a SNAP participant and if I want to buy an energy bar, am I going to experience a shaming rejection at checkout if that's classified as a candy bar? We don't quite know how that's going to work out. There are 12,000 new products introduced into the U.S. food supply every year. Until now, the U.S. Department of Agriculture hasn't wanted to introduce new restrictions in the program because they don't know who's going to keep an updated inventory of which products are SNAP legal and which are SNAP illegal. A second problem is what I see so far is an absence of any plan to do careful state-level studies of the results of these waivers. The waivers are temporary, only for 2 years. The purpose originally of having this waiver option was to learn what a change would do to dietary health. The states that have received these waivers so far, I don't see a lot of evidence that they have careful plans along a baseline to see if soda consumption actually comes down or do out-of-pocket expenses compensate for the SNAP blockage. Another problem is, frankly, what else is new? Partisanship. 11 of the 12 states were Republican states. and Republicans and Democrats have different views of the SNAP program. The agenda in some Republican states isn't just to improve dietary health, but also to shrink what they see as a swollen welfare program. So the dietary health agenda of the MAHA movement might be pushed aside to some extent by the SNAP shrinkage motive of the MAGA movement. We don't know where that's going to end up. Yeah. But very quickly, one final concern I have is with the limited promise of any attempt to improve dietary health in America through the SNAP program alone. Only 12% of Americans participate in the program. So even if you make gigantic improvements in the dietary health of SNAP recipients, the other 88% of us are still surrounded by unhealthy, ultra-processed foods and still consuming those to excess. Yeah. So we need a broader focus than just SNAP.
Yeah. So thank you for raising all those points and really helping us understand, you know, the challenges and things on both sides. I will say that having read the USDA approvals for all the waivers, they're actually quite detailed on the required evaluations. And so we have to see if the states will follow that. But USDA was very clear that these programs have to be evaluated. They're waivers. They're testing a new approach. We have to see what's the impact on SNAP recipients, what's the impact on their lives, what's the impact on purchasing, what's the impact on their health. I think that's important. I will say, Rob, for the complexity of scanning, right now, SNAP doesn't allow any hot prepared foods, but allows cold foods. And so you can go get a burrito that's cold and microwave it in a 7-Eleven, but if there's a burrito under a warming lamp in the 7-Eleven, you can't buy it. And so SNAP is able to navigate, I think, the complexities of UPC codes. So I'm not worried about that. And I actually, one of the states, I think, actually helped reverse that and said not only can SNAP recipients not buy soda or candy, but they can buy healthy hot food like rotisserie chickens and other things. So I think there's an opportunity to improve the program. Jennifer, what are your thoughts on the states and what they're doing kind of around ultra-processed foods and their innovations?
So the states are definitely the leaders. They're seeing a gap in historical FDA oversight over the ingredients. Dari talked about the GRAS loophole, but also historically, not this administration, but before, the FDA has not had any type of framework, a comprehensive framework or a resource framework to evaluate the ingredients that are already in the food supply. And so they're not well resourced to do so either. So what that means is that it has taken decades for the FDA to actually remove ingredients that we know are associated with health harms. Red dye 3 made national news. They removed it from cosmetics for being associated with cancer in 1990, but then waited till last year or this year to actually remove it from the food supply, despite the Delaney clause, which says that we have to get cancer-causing ingredients out of the food supply. There's other things. Brominated vegetable oil took 53 years to remove after evidence of health harm. Industrial trans fats, 30 years, even though the Institute of Medicine told us to reduce it, 20 years ago. So we have, in the face of this lax post-market environment, the states have really jumped in and are protecting us. As we heard about West Virginia, there are about 30 states with similar bills as West Virginia's, both trying to remove the food additives from school foods or from the states. Some very innovative labeling laws. Texas has one of the best labeling laws that came out of this movement, and other disclosure laws. So one of the things that was really heartened to hear Senator Marshall saying that he doesn't want to stop this state movement, and this is what we in public health, we really want to encourage the states to continue. And preemption, which is removing the state's right, we're not there. This is not the place for it. For 120 years, the federal and state governments have been concurrently functioning on food safety. It would be unprecedented to remove the state's ability to oversee food safety. Remember, the food industry is already selling products that have removed the ingredients that West Virginia is seeking to remove in other countries while exposing Americans to the same ingredients. They can engage in different marketplaces. And also, there's just not any type of track record yet for the FDA to be the sole arbiter of food safety. We have to, there's resources FDA needs, additional authorities, regulations. So we're not even there yet to say that we should be removing the state's authority.
Yeah, thank you, Jennifer. I think that preemption is what industry is going to push for the federal government to sort of pull back on the state's ability to do this. So Kyle, as the person who's come into FDA to really lead the human nutrition program and all of the issues around nutrition, which, by the way, I think if I'm not going to get it wrong, the budget's around $100 million, and most of that's for food safety, not for actually nutrition. I think the budget for nutrition is even smaller, out of a $7 billion FDA budget. So the F in FDA is very tiny, and we need that F to be bigger and better resourced. But in the last few minutes, first, maybe you can comment on ultra-processed foods and what your agency is doing about ultra-processed foods, and then maybe next about GRAS and this issue of the GRAS loophole, because I know you've thought a lot about both of these issues.
Yeah, thanks, Dari. And I want to give a thanks to the Food Tank and Food as Medicine Institute as well for the invitation today. Look, there is a chronic disease epidemic in this country. I like to call it a national nutrition crisis that we're trying to solve. We've taken significant action already on dyes, eliminating all of the petroleum-based dyes that West Virginia has also worked on. Talk about GRAS reform. We have put out an RFI earlier this year to define ultra-processed foods. That's something that we really think we need to do at the national level to help usher in some of these changes. That comment period closed in October. We got about 19,000 comments on that, so we're working very quickly to analyze those comments and work on next steps. I can tell you that as a whole of government approach, defining ultra-processed foods and tackling these issues is a priority for this administration, a 2026 priority. We're doing work with NIH. My friend Dr. Jay over there and I have worked on a nutrition regulatory science program. We'll have some new announcements coming soon on that, but we're really excited to be able to use that program to fund some research on things like how do ultra-processed foods impact the gut microbiome. So there's a lot of work that we're doing and that we want to do. GRAS reform is another one. One thing I do want to say is that the Human Foods Program at FDA has a vast remit. We regulate 80% of the food supply in this country, 230,000 facilities, 30,000 farms. We assist over 500 recalls a year. And we do all of this on a budget that's about half the size of the Dallas School District's budget. So a relatively small budget given the vast federal remit that we have. And so this is not a problem, this chronic disease problem, diet-related chronic disease problem we have in this country. It's not something that we can solve alone at FDA. It really does take Congress. It takes industry, academia. It takes consumers to continue to advocate, to look at food labels. We're seeing data now showing that over half of consumers are actively looking at food labels. Those are the highest numbers we've ever seen. And we know that companies will respond to how consumers use their pocketbook, even more so than what we can do from a federal perspective. We are absolutely committed to doing things like front of pack labeling, defining ultra-processed foods, closing the GRAS loophole. All of these changes on both the nutrition, the food chemical, and the microbiological food safety side. But I just want to stress that this is something that will take a societal movement to continue to advocate for. I think the work that Secretary Kennedy has coalesced under the MAHA umbrella has helped push this. But to be successful, this will take years of continued buy-in by all sectors, by private industry, by consumer groups, by government, by Congress. And we do have to work on the reform. So we're really excited about the work we're doing. If I could just spend 20 seconds on GRAS. We have proposed at Secretary Kennedy's request earlier this year to reform the GRAS loophole through regulation. We also know there are several bills pending in Congress to also close the GRAS loophole. So we're taking a two-step approach where we're going to try to do that through rulemaking. We've got a regulation, an NPRM that's pending at OMB to close the GRAS loophole. And it's something that we're really committed to. It's a priority of ours, and we're hoping we can execute on that in 2026.
So, the list, if you're not in this space, the list of things that Kyle just described that they're doing have been on the public health nutrition agenda for 30 years and have not been addressed. And so the fact that Kyle and the FDA and Commissioner McCary are actually addressing these things and planning to do it, and there's rules at OMB, is pretty remarkable. And the other thing I'll say in closing, is that, we worked quite a bit with Congress in the last administration. We worked quite a bit with agencies in the last administration and in this administration. I really think this is the one theme that has crossed administrations unchanged. Both administrations, the prior one and this one, really wanted to address food and think about food and nutrition through different ways, through different means, but this is not a partisan issue. Health is not a partisan issue. We have a broken healthcare system, we have a broken food system, and we have a broken agricultural system, and those three things are tightly interlinked, and they're all fixable. They're all fixable. So thank you so much to the panel. Really great to have your expertise here. Thank you for what all of you are doing in your ways to address this problem. Thank you.
Great discussions. Thanks to Dari and the panel, as well as Senator Marshall. Please give them another round of applause. It is now my honor to welcome to the podium U.S. Member of Congress Jonathan Jackson, who represents Illinois' 1st District and serves on the House Agricultural Committee, to say a few words. Please give him a round of applause.
Happy holy season to all of those in the celebratory mood. I would like to address my remarks on eating ourselves sick. My friends, in the long chronicle of this nation, we have confronted many foes, some visible, others hidden beneath the calm surface of daily life. Today, I speak of a very subtle enemy, yet profoundly destructive, the quiet, persistent crisis of people eating themselves sick. In a land of extraordinary abundance, it is a bitter irony that so many Americans, particularly the poor, the marginalized, and the forgotten, subsist on food that undermines their very existence. We are surrounded by ultra-processed products, manufactured in laboratories and factories, engineered for profit and not for life. These foods, bright in color and hollow in nourishment, seduce the palate while weakening the body. The flood of communities with sugar, salt, chemical additives, and empty calories, fueling epidemics of obesity, hypertension, diabetes, and premature death. Yet, to cast this as a mere matter of individual choice would be to ignore the deeper structures of inequality that shape American life. For what choice exists where there is no access? What freedom is there when there's a community where a head of lettuce is harder to find than a bag of potato chips? And where the nearest supermarket lies miles away across highways and forgotten across the rural roads? In urban America, like the district I serve, in Illinois' 1st Congressional District, we see ghettos that have been formed, created by decades of segregation, redlining, and economic abandonment. Vast structures of neighborhoods remain where there's food as deserts, oasis in name only, where the only readily available substance is processed, packaged, and poisoned in slow measure. And in the rural part of my district, we find where the fields themselves feed the nation, too many communities endure a similar scarcity, where poverty, dwindling resources, contracting store base, and vanishing infrastructures deny families access to the fruits and vegetables that they need that come from their own labor. This too, I would share with you, is a color line. This is one of the reasons why it started with my colleague, the Diversity, Equity, and Inclusion Caucus. We cannot let the president take these honorable and noble words out of our mouth. Yes, I said it, and I say it proudly. How else can we remedy this condition? Drawn not only in wages and housing, but in the very nourishment of the human body. And the cost of these injustices is immense. I seek not to fix the blame, I want to fix the problem. Diversity and equity and inclusion was a step towards remedying the problem. Our nation spends billions, indeed trillions, out of a $4.5 trillion healthcare budget. Too much is spent on the health care and not the cure of the problem. Treating diseases that flourish in the soil of poor nutrition. Hospitals overflow, insurers calculate their risk, and we as a people exhaust our resources. People trying to get the necessary help in order to cure the illnesses that could have been prevented in the very beginning. Something as elementary as access to wholesome food. We debate endlessly the mechanisms of health insurance, yet we rarely speak with equal passion about health itself. How is it built? How is it supported? And how is our health system sustained? Insurance, after all, is a shield. But what use is a shield when the arrows never cease? True health requires more than money. It requires justice. It demands that we confront the social and economic forces that condemn entire parts of our population into diets that sap their strength and shorten their days. The question before us I will share with you then is not solely medical. It is economic, it is political, and it is indeed moral. Will we allow corporate profit, governmental neglect, and social indifference to determine the health of millions? Or will we, with clear eyes and a steadfast will, reshape the conditions under which Americans live, eat, and die? We must build grocery stores where none exist. We must create a new economic paradigm that will make groceries profitable because it sustains our life. We must support farmers and local markets that bring fresh food to every table in America. We must teach our children not only the science of nutrition, but the history of injustice that has shaped their communities. And yes, we must declare with unwavering conviction that access to healthy foods is not a privilege reserved for the affluent, but it is a right inherited in every human being. For the measure of a civilization, I would share with you, is not the wealth and not its riches, but the well-being of its poorest. And a nation that feeds its people food that sickens them cannot claim to be great. The future of American democracy rests not only on ballots and laws, but on the strength, vitality, and dignity of its people. Let it not be said that we had the knowledge to heal ourselves and yet chose the path of a slow decline. Let it be said instead that we saw the danger, rose to meet it, and nourished a stronger, healthier, and more equitable nation for all. We can find the cure if we have the will. I thank you.
Powerful, powerful words. Thank you, Representative Jackson. Keep that round of applause going for a moment. Thank you. I'm now excited to sit down with Representative Maxine Dexter, who represents Oregon's 3rd District. Thank you so much for joining us. Please give her a round of applause. Nice to have you here after Climate Week. Thank you. I'm wondering, Representative, if you can talk about, you were trained as a physician, and I wonder how that impacts what you're trying to do in Congress right now.
Yeah, and first, thank you, Danielle and Food Tank and everyone here for having me. This is such an important conversation, so really grateful for everyone's interest. It's great to see a full room here. So yes, I am a pulmonary critical care doc in Oregon. And you know what really is very clear is exactly what Congressman Jackson was just talking about, that what we are feeding our families is making us sick, whether it is diabetes, where people don't have access to healthy food or don't have time and they're eating simple sugars and other things, soda that is indirectly subsidized in this country. We have a lot that we need to do. And as physician, the vast majority of really sick patients that I saw, we would say, it's the usual diabetes, heart disease, hypertension, and plus or minus COPD. Those were the patients I saw in the ICU. And disproportionately, if you are obese, you have worse outcomes. And so we are not just making our people sick, we are increasing the cost of healthcare. We know that about $1.1 trillion of cost in our healthcare system's $5 trillion expenditure is directly related to poor nutrition.
And Representative Jackson talked about this in his remarks that, poor folks are suffering the most from a lot of this. And so I wonder how you think about increasing access to healthy food, not just having those grocery stores and farmers markets, but having people allowing people to have the ability to afford those products.
Yeah, without question. And this is a bipartisan issue. I think that there are a lot of things about what the MAHA movement and other things are saying that, frankly, I agree with. And those are fighting words in a lot of the more liberal parts of my district. But I will just tell you that food is medicine, and we need to treat it with the priority that it deserves. Making sure that we're talking about urban farms, planting trees along the streets and harvesting so that people have access, but also not having food deserts, as Congressman Jackson talked about. We can have subsidized grocery stores that actually have healthy food, not just subsidizing corn and other simple products that then end up in those, ultra-processed foods. So we are making investments as a country that lead directly to this outcome. And way back in the 90s, I remember reading about the slow food movement and the ways that Europe was really transforming how it thinks about food. We can do this. We just need the collective will to do it. And thank you all for having that.
Yeah, this room speaks hopefully to that collective will. I want to go back to, your experiences as a doctor. And Senator Marshall talked about this. He's a doctor. Dari talked about this. He's a doctor. But medical schools are not preparing all of you to go into the world and speak about nutrition in productive ways to your patients.
Yeah. I have a couple things, and these are not meant to be fighting words, but I really believe that every person, every professional in the healthcare system should be practicing at the top of their scope. And nutritionists are not they can't bill in the same way. They are not valued in the same way. I can speak about nutrition, but you need the nutritionists at the bedside talking to our patients. They're the people who should be having that conversation. And so what we need to do as a system is also value their expertise and their time and pay for them to be there. It is a much better use of their time because they're better at it. And it's also, I'm more expensive, quite frankly. So I should be doing the things that are at my top of scope. So the way we get there is to stop using fee-for-service medicine as a method for payment. We have to incentivize the outcomes that we want. Keeping people healthy means that we put nutritionists in the hospitals and in the clinics. It means that we have community health workers that are making home visits and finding out where people are shopping and what they have in their cupboards. It means that we actually liberate the system to do the right thing for our community in a very culturally competent way. Not everyone should be eating the same foods, and we need to recognize that. So I do not endorse medical schools, spending more time training us to talk about it. You got lots of people here. We need to pay them to do it.
Absolutely. The round of applause for the nutritionist, please. I'm back to the issue of ultra-processed foods. What would you like to see moving forward on this issue in Congress?
Frankly, we have to stop subsidizing it, whether it's corn or whether it's palm oil or, maybe, I know that that's not in our country, but mostly. But we have a lot of choices that we can make, whether it's the double up food bucks for fresh fruit and vegetables at farmers markets. We have to also incentivize local food supply being used like we have done in our public school system in Oregon. There is always like the vegetable of the month and the fruit fruit of the month that goes on the tray and it's fresh, and kids start learning that it's actually grown in their communities and learning, how to choose what kinds of fruits and vegetables you like by actually tasting them rather than just looking at them. We have to incentivize with subsidies, I think. People don't have resources right now. It's too expensive to buy groceries. SNAP, we were talking about SNAP benefits. Like, it's much more feasible to feed your family high calorie, concentrated, processed food on that budget than it is to go have fresh fruits and vegetables. I grew up in a poor working class family. I never saw a fresh fruit or vegetable growing up. It was all canned, sometimes frozen, except for maybe at Thanksgiving, which was usually cranberry sauce out of a can. Like, I just didn't know that potatoes didn't come in a box that you added hot water to. So I think, and I know I see surprised faces out there, but this is real for so many of our patients and our families. Like, they don't see fresh fruits and vegetables because they're going to the bodega on the corner that doesn't really have that available to them, and they're paying too much because they don't have access to transportation to get to the more affordable Costco's or whatever that you can buy higher quality, higher nutrition value fruits and vegetables. So we need to liberate SNAP. We need to incentivize grocery stores in our communities to actually have the fruits and vegetables available. We need those bodegas to have subsidies to get those fruits and vegetables there. And once people want them, they're going to find them. But you have to have the market demand for those things to then drive production. That's not what we have right now.
I'm glad you brought up production, and Dari and Representative Jackson mentioned the role of farmers earlier. Food is medicine does not work without farmers.
Right.
And I wonder how, your ideas around supporting more small and medium scale farmers to really support food as medicine.
So I'm a doctor, so I'm sure that Angie Craig and others will have a lot more thought out ideas, but I represent a rural part of our state, and we have orchard fruits for the most part, and those producers cannot sell their cherries and their pears and their apples in local community grocery stores because they're too expensive to produce. So we also need our farm workers and agricultural workers to make a living wage. So if we're going to have to spend more money to produce these goods, then we need to put again, the farm subsidies where the high quality, nutritious food comes from, and those small farmers, those local community, urban farms. I do think we need to invest in that. And subsidies are not forever. We just need to drive demand and drive production to the point where people can do the work and get what they need out of the production. And whether it's that again, Angie Craig and others would have a lot more thoughtful answers on this, but we have to pay farmers to produce the fruits and vegetables that we need. They can't be sending them across the world when we need them here, and figuring out a way to be able to afford them. It's better for all of us. It's certainly environmentally more sustainable. I don't begrudge China having cherries and Japan having the apples and pears that we produce, for sure, but we also need to be able to afford them right in our backyards where our community can't literally afford to buy the things that they drive past growing as they go to school and work.
Fantastic point to end on. Thank you, Representative Dexter.
Thank you.
Thank you so much. I'd like to invite Dari back up to the stage to introduce our final closing keynote.
Thank you so much. I want to give a shout out to Beyond Fruits and Vegetables. I want to give a shout out to nuts, to seeds, to beans, to intact whole grains, to fish and seafood, to yogurt, to hard cheeses. There's a lot of healthy foods, and so all for fruits and vegetables, but there's a lot of other foods that we really need to get in our food supply. So our anchor, our closer, the man you've been waiting for, we're really pleased to have, with his busy schedule, the Director of NIH, Dr. Jay Bhattacharya, to talk about how NIH is thinking about this incredible challenge of food, nutrition, ultra-processed foods. Thank you so much. Yeah.
Morning, everyone. Good morning, everyone. It's great to be here, and it's great to be here as the director of the NIH, because research is a fundamental contributor. Although, as you've heard, policy and so much else is also important. But research is a fundamental contributor to better decision making about food, not just at the policy level, but at the individual level, at the patient level, for everyone. And the NIH has played and will continue to play an outsized role. And under my leadership, we're going to play a larger role than we have played in the past. I want to thank the Food of Medicine Institute at Tufts and the Food Tank for convening this critical conversation. I'm honored to be with you to address this absolutely vital aspect of our country's health, in particular ultra-processed foods and the impact on American health. Poor nutrition is not a side issue. As you've heard today, the reason for the MAHA movement, the reason why it has resonated with tens of millions of Americans is because we as a country are chronically ill. And one of the major drivers of it is the food that we eat. We have diet-related chronic diseases like obesity, cardiovascular disease, hypertension, diabetes, stroke. All of these are the leading cause of disability and death for Americans. In the last, it's a decade and a half, since 2010, the US has experienced a flatlining of life expectancy. No change in life expectancy from 2010 to 2019, collapsed during the pandemic, and just past year, we're finally back to where we were in 2010. This is an absolute crisis that needs political, scientific, medical, and public attention. It's a call to action that I've been a researcher who studied obesity or who studied food supply, food use for all my entire career, and I have to be honest with you. It's been a very frustrating time because you do a research project and no one pays attention to it. I'm sure you've seen this, Dari. In the past year, Governor Huckabee of Arkansas cited a paper of mine, which I'd completely forgotten I'd written, in justifying restrictions on SNAP use for sugar-sweetened beverages. Because sugar-sweetened beverages contribute to the diabetes problem for children. What you have is a tremendous moment of hope, and I'm telling you, someone who's been in the space for a very long time, a tremendous moment of hope where we can actually make a difference. The research that so many folks have done can be put into action for the first time in my adult lifetime. And I'm tremendously, touched, you can probably hear in my voice, that this moment is possible. And I frankly, I almost can't believe it. The UPF connection. So the ultra-processed food, by some measures, comprise roughly 60% of American calories. Understanding the role in the epidemic is essential to developing effective interventions, and that's why research matters. We need evidence that is rigorous in scientific foundation, bold in potential impact, and practical enough to transform health in the real world. And this is precisely what the NIH is for. That is literally our mission, is to do research that improves the health and longevity of all peoples. And if you think about where nutrition science is, I'll just tell you my personal connection with nutrition science from when I was 8 years old. The advice came out that eggs were terrible. Anyone remember? Most of you in the room are not old enough to remember this, but you remember this? My family stopped eating eggs. I didn't see an egg for another 10, 15 years. It was just they never entered my household. Then apparently egg whites were healthy, but egg yolks were not. So we threw away so many egg yolks. I'm sure you all have had similar experiences as you were following the science. And now eggs are a superfood. The root problem is not that science sometimes has the wrong answer. That's typical in science. The root problem is that we have to do more rigorous science, especially for something as fundamental as food. And we have to put the best scientific minds on it. We have to put the resources of this great country on it, and we have to make sure that the science that is done is rigorous, reproducible, not biased in any way by financial incentives, but just give honest answers so that policymakers can make good decisions and families can make good decisions about what they eat. So that's exactly what we're about. Another critical piece of this puzzle, and Kyle Diamantas mentioned this, is the NIH FDA Nutrition Regulatory Science Program. It's an absolutely unprecedented collaboration between the NIH and the FDA, where the research that the NIH does will be put into direct regulatory action by the FDA. The initiative will strengthen the scientific foundation that informs policy and regulation of food and nutrition, and it represents a critical new tool for addressing questions that are central for the ultra-processed food debate. Which food components and additives should be prioritized for health impact studies? We've already heard a lot about red dye number 3, but if you look at almost any ingredient list that you find, there are all these things that I went to medical school, I can't pronounce them, and yet we eat them. Just because I can't pronounce them doesn't mean they're bad. Let's do research to find out. How do processing methods for formulation change health outcomes? What's the evidence base for regulatory decisions around ultra-processed food? So much of food is regulated with this generally recognized as safe, but what is the scientific basis for that recognition of the food as safe? And how it'll work? The FDA will bring expertise in regulatory sciences to the table. The NIH will provide infrastructure to fund, review, and manage research, and together we'll support studies that directly inform food policy and regulation. The findings of the program will directly inform how we design food as medicine approaches, ensuring that the foods provided are not only nourishing, but grounded in the best available evidence. It's another way that we're conducting research to policy and then policy to practice. So this is the moment for food as medicine. The science has matured. At the NIH, we've already made many investments. We're going to continue to make those investments. Since 2021, the direct investments in food and medicine as a program grew from $5 billion in 2021 to almost $9.5 billion last year. And in addition to that, there are 47 investigator-initiated projects. So you can see that the scientific community is hungry, if you will, to coin a word, for research on this topic. And we've invested $25 million across 10 NIH institutes on this. It's not just a single institute, but every single part of the NIH is interested in this because food impacts every aspect of human health. We need to understand what foods provide, that's food and medicine, and what to avoid and reformulate, ultra-processed foods, to create a comprehensive nutrition strategy. And we need mechanisms. How do processing methods, additives, formulations affect metabolic health? What components drive adverse outcomes? Are certain populations more vulnerable? And we need policy evidence, right? I heard earlier a call for research on these policy interventions on ultra-processed food. I would love to fund that study. And when investigators come to us, we're going to prioritize these kinds of experiments now that are happening to assess, because we can't just have one answer. We have to assess what we've done and see what worked and what didn't work, and then make changes on the basis of that. Addressing ultra-processed food isn't about returning to the past. It's about using the best science to shape a healthier future. And the NIH is absolutely committed to evidence that scales, informs lasting change, and improves lives. Thank you for your leadership on this critical issue. Again, ultra-processed foods is one of the most significant and modifiable drivers of America's chronic disease epidemic. And I'm delighted to report that the NIH will play a key role in addressing the science of this so that we actually really can make America healthy again. Thank you so much.
So if you have a couple minutes, we can ask a couple questions. Please have a seat. Join me. So thank you, Dr. Bhattacharya. For again, those of us in the field who've seen this for so long, it's so refreshing to hear the director of NIH really understand the problem and want to start to address it. You mentioned there's 27 centers and institutes, all of which do important nutrition research and should continue to do so, and yet a 2021 Government Accountability Office report identified that work tends to be fragmented. On the flip side, both the House and Senate appropriations bills that have passed have called out food as medicine at least a dozen times each and highlighted your office and the Office of Nutrition Research as ways to organize that. And so how do you see your ability as the director of NIH, the Office of the Director, to really help catalyze kind of a national food shot in nutrition science?
It's a great question, Dari. And I'll just say I came into the NIH about 9 months ago. Actually, what I saw was not what GAO report said in 2021. What I saw was a real desire to catalyze research on food as medicine and on nutrition more generally across the NIH. I sit in this is this geeky sort of organization of NIH, so the only two people on earth really need to know about. But but there's the Office of the Director, and then there's these 27 institutes, many of which are like science-focused institutes on different parts of human health, national heart, lung, and blood, diabetes, and so on, right? The goal, what I saw was that the Office of Nutrition Research is doing an amazing job at making sure that everyone understands what everyone else is doing internally. I mean, that's its primary role. And then to bring opportunities to the different institutes for when scientific opportunities come up across institutes. I'm not saying we're doing it perfectly. I know we can do it better. We always can. But the key thing to me is the cooperation, the scientific cooperation across the institutes. And what I've seen in the 9 months I've been there is actually really, really quite positive. In many ways, I was a professor at Stanford for many years before. It's harder to cooperate with other professors at Stanford than it is for NIH researchers to cooperate with each other, and also to engage with the external research community. That's a major goal of mine, to make that happen. And if those in the room who do research, let me know where we're doing well and where we're failing at that. And my aim is to make that work.
That's terrific. Thank you. I think that's incredibly important. While we're thinking about ways to reduce ultra-processed foods and understand the science, there's also the science of using healthcare dollars to support healthy eating through food as medicine, through produce prescriptions, medically tailored meals, and other things. The NIH has had an approved concept to create these centers of excellence in food as medicine, which would be similar to the cancer centers of excellence that are really the top cancer centers around the country. I think every state or almost every state has one now. So that hasn't yet been funded by Congress. And the House bill actually has called for funding for this. The Senate bill is quiet on this. I'm hoping this will get resolved. What do you think about the role of NIH to work with healthcare and start to address some of these questions of how doctors can prescribe healthy food for the right patients, for the right conditions?
I think that's tremendously exciting, Dari. I think the idea that you can use diet to address dire health needs is it's actually not that controversial, right? So if you're a type 2 diabetic, you're going to get a prescribed diet, right? That is a normal part of medicine. And if you think about health more broadly, well, why just type 2 diabetes? Like the sort of like the focused, personalized interventions, maybe by nutritionists. I hope also in cooperation with folks and doctors. That I think is a tremendously promising approach to advancing health. But it needs science. It needs a lot of science to get this right. Yeah, as you said, Dari, there was a concept that was approved by our Council of Councils for exactly this kind of program, to develop the science of food as medicine. That was in 2023. We're still waiting for Congress to support it. I think, I'm not supposed to encourage lobbying, but I do very much think that this is a promising scientific area that will have the capacity and the promise to advance human health.
I can't tell you, you said you were a little choked up emotionally, thinking about this. To have the director of NIH come and speak at a session on ultra-processed foods, talk about his prioritization of health, nutrition, food as medicine, to announce the need for regulatory grade science that Commissioner Rob Califf announced at he said, former FDA commissioner, we need regulatory grade nutrition science, to talk about all these issues and to be pushing them forward. We're really grateful for your leadership. Thank you so much. Yeah.
Thank you so much, Dari.
Great way to end this event. I want to thank all of our speakers. I want to thank the Food as Medicine Institute at Tufts University. I want to thank all of my food tank colleagues who did an excellent job. I want to thank the catering folks as well as the production crew. Please give them a round of applause real quick. And I want to thank you for spending your afternoon with us. Thank you so much for being here. Give yourselves a round of applause and good afternoon.
We can get the secretary.